More than 1 million people over 60 take medications that, instead of protecting, are quietly weakening their hearts every day. As a heart surgeon with over 40 years of experience, I've seen this happen time and again. Older patients come to my office worried about new symptoms: chest pain, unexplained tiredness, or trouble breathing, often unaware that the cause might be right in their medicine cabinet. Many of these drugs were prescribed with good intentions. Others are bought over the counter, part of a routine for years. But what's not talked about enough is that our bodies change as we age. What was once safe can now become a hidden risk. In fact, some common medications can raise blood pressure, cause fluid buildup, disrupt heart rhythms, or even weaken the heart muscle directly. The worrying part is that these side effects don't always show up right away. It can take months or even years before clear symptoms appear, and by then the damage may already be underway. Many patients and their families feel confused or even guilty, thinking they did something wrong, when really they just needed the right information at the right time. This guide isn't meant to scare you, it's meant to give you clarity. Today, I'll share the 8 medications most harmful to the heart for older adults, even when prescribed by a doctor. Beyond listing the risks, my goal is to help you talk to your doctor, review your options, and take charge of your health in an informed and responsible way. If you or someone you love takes medications for pain, sleep, blood sugar, blood pressure, or mood, stay with me until the end. What you learn could make the difference between a life limited by heart problems or a longer, more active and fulfilling life. Let's start with number 8. And trust me, the number 1 medication is as common as it is dangerous. Number 8, long-term oral corticosteroids. Many older adults take oral corticosteroids like prednisone or dexamethasone to manage pain, inflammation, or autoimmune conditions. But few realize that when used for a long time, these medications can become a silent threat to the heart. As a heart surgeon, I've seen too many seniors come in with unexplained tiredness, swollen legs, or shortness of breath, not from a new illness, but from the cumulative effects of these drugs. Corticosteroids disrupt the body's balance in serious ways. They increase salt and water retention, which raises blood pressure and forces the heart to work harder. They also raise bad cholesterol, LDL, lower good cholesterol, HDL, and increase blood sugar, creating the perfect storm for damaging arteries over time. The most dangerous part is that this happens without pain or clear warning signs. You might feel a bit puffy or more tired than usual and blame it on aging. Meanwhile, your heart is quietly weakening. Recent studies have linked long-term corticosteroid use to a significant increase in the risk of heart failure, irregular heart rhythms, and serious cardiovascular events. Even doses considered low can have cumulative effects in older adults. This doesn't mean you should stop your medication on your own. Instead, talk to your doctor. There are alternatives: dose adjustments, intermittent treatments, or even non-drug therapies that could help manage your symptoms without harming your heart. Your heart has been with you your whole life. Now, give it the care it deserves. What seemed like a routine treatment might be affecting your energy and health without you knowing. Don't wait until you feel worse to act. Ask questions, get informed, and protect your health with thoughtful choices. Number 7. NSAIDs, non-steroidal anti-inflammatory drugs. Let's start with one of the most common medications among older adults, non-steroidal anti-inflammatory drugs, or NSAIDs. These include drugs like ibuprofen and naproxen, which many people over 60 take daily to ease arthritis pain, muscle aches, or back discomfort. At first glance, they seem safe, but the truth is, they can quietly threaten your heart. These medications work by blocking enzymes that cause inflammation and pain. However, they also disrupt important body functions. For example, they can raise blood pressure, cause fluid retention, and reduce kidney function. This means your heart has to work harder to keep things balanced, which can be very dangerous if you already have a weakened heart or a history of heart disease. The tricky part is that these effects don't usually show up right away. Many seniors feel fine taking NSAIDs for weeks or even months, but over time, their cumulative impact can harm blood vessels, put extra strain on the heart, and worst of all, interfere with other medications like diuretics or blood pressure treatments. I've cared for patients who came to the hospital with unexplained tiredness, swollen ankles, or shortness of breath, and we found the issue wasn't a new illness, but but long-term use of pain relievers without medical oversight. That's why I always tell my patients, if you're over 60, don't underestimate what a common painkiller can do to your heart. There are safer alternatives like gentler medications or physical therapies that relieve pain without risking your heart health. But never stop a medication on your own. Always talk to your doctor. Pain relief shouldn't come at the cost of your heart's well-being. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 6, thiazolide dienines, type 2 diabetes medications. If you're managing type 2 diabetes, you may have heard of or even been taking a class of medications called thiazolide dienines. This group includes drugs like pioglitazone. Their main job is to help lower blood sugar levels, and for years they've been a popular choice for diabetes treatment. But what many don't know is that these medications can have hidden and serious risks for the heart, especially for people over 60. Thiazolidinediones work by making your cells more sensitive to insulin, which helps control blood sugar. However, they also cause the body to retain fluid. This means your tissues hold more water than usual, which can lead to swelling in your legs and ankles, weight gain, and most seriously, extra pressure on your heart. For older adults who already have some heart weakness or a history of heart disease, this fluid buildup can trigger congestive heart failure. Even more concerning, these medications can hide early signs of heart failure, like tiredness, shortness of breath, or feeling low on energy. This delays diagnosis and allows damage to progress quietly. I've seen patients who thought their fatigue was just normal aging or a bad day, when really their heart was struggling to handle a load it couldn't sustain. In other cases, swelling in the legs was blamed on heat or lack of movement, not linked to the medication. If you're taking thiazolidinediones and have a heart history, it's vital to talk to your doctor. Ask if there's a safer alternative. Today, there are newer diabetes medications that not only control blood sugar but also protect your heart health. Managing blood sugar matters, but not at the cost of silently weakening your heart. Number 5, sedative hypnotics, sleep medications. Many older adults struggle with sleepless nights, restless sleep, or feeling tired upon waking. In search of relief, they turn to sleep medications, also known as sedative hypnotics. Common ones include zolpidem or older drugs like diazepam. While these medications promise a peaceful night's rest, what many don't realize is that they can have serious quiet effects on the heart. These drugs work by slowing down the central nervous system, which may sound helpful at first. They ease anxiety, relax the body, and help you fall asleep. But this same effect also reduces your heart's ability to handle stress or effort, even while you sleep. Over time, this constant slowing can disrupt your heart's natural rhythm. One of the biggest dangers of sedatives in older adults is their link to sleep apnea, a condition where breathing stops briefly during sleep, reducing oxygen to the heart. Sedatives can worsen or even trigger sleep apnea, raising the risk of life-threatening heart rhythm problems. They can also interfere with essential heart medications like beta blockers, making them less effective. Plus, these drugs increase the risk of falls, confusion, and breathing difficulties, especially for those taking multiple medications or living alone. I've heard many patients say, "It's just a sleeping pill," but that pill, taken night after night, can slowly weaken both your brain and your heart. The worst part is that many become dependent on it without realizing, thinking there's no other way. The good news is there are alternatives. Better sleep habits, relaxation techniques, cognitive behavioral therapy, or even natural supplements can work well without serious side effects. If you're regularly taking sleep sedatives, talk to your doctor. Ask if you truly need them and explore a plan that keeps your heart safe while you rest. Number 4, tricyclic antidepressants, medications for mood and chronic pain. For many years, tricyclic antidepressants have been used to treat not only depression, but also anxiety, insomnia, and certain types of chronic pain. Medications like amitriptyline or nortriptyline are still prescribed, especially for older adults. However, what isn't always made clear is that these drugs can pose a significant risk to the heart, particularly for those over 60. Tricyclic antidepressants affect how electrical signals travel through the heart. This can lead to heart rhythm problems, such as irregular beats, heart block, or even a dangerously slow heart rate. They can also cause sudden changes in blood pressure, making it rise or drop unexpectedly. One of the most concerning issues is that these effects can go unnoticed. You might feel more tired, slightly dizzy, or notice an odd fluttering in your chest, but not connect it to your medication. In older adults, these symptoms are often mistaken for normal aging, delaying diagnosis even further. Beyond their direct impact on the heart, tricyclic antidepressants also increase the risk of falls and mental confusion, especially when combined with other medications. For seniors, a fall can have serious consequences, not just physical, but emotional and functional as well. I've had patients who continued taking these antidepressants for years, unaware that safer alternatives were available. If you're using these medications, talk to your doctor about newer options that can support your mood or manage pain without putting your heart at risk. Your heart's health is worth the conversation. Today, we have newer antidepressants that are not only more effective, but also much safer for your heart. If you're taking a tricyclic antidepressant or have been on one for a long time, don't panic, but do take action. Talk to your doctor. It's not about stopping the medication suddenly, but about checking if there's a better option suited to your age, health, and emotional needs. Taking care of your mood shouldn't put your heart at risk. Number 3, decongestants, pseudoephedrine or phenylephrine. Nasal decongestants like pseudoephedrine and phenylephrine are found in many over-the-counter cold, flu, and allergy medications. Millions of people use them to relieve stuffy noses or sinus pressure, especially during seasonal changes. They may seem harmless, but for those over 60, these drugs can pose a real threat to heart health. These medications work by narrowing the blood vessels in your nose to reduce swelling and mucus. However, this narrowing effect doesn't stay in the nose. It affects blood vessels throughout your body, including those supplying your heart. As a result, they raise blood pressure and make your heart work harder, which can be very dangerous if you have high blood pressure, heart disease, or irregular heart rhythms. I've had patients who, after taking a decongestant, felt heart palpitations, extreme nervousness, sleeplessness, or even severe anxiety. In some cases, a single cold pill triggered an episode of atrial fibrillation or a dangerous spike in blood pressure. The problem is that because these are over-the-counter drugs, many assume they're completely safe. But what's often overlooked is that a 60 or 70-year-old body doesn't react the same way as a younger one. Sensitivity to side effects increases and risks multiply if you're also taking other heart medications. Symptoms like shakiness, sleeplessness, or restlessness can easily be mistaken for stress or the cold itself, not the medication. My advice is clear: always read labels. Avoid medications with pseudoephedrine or phenylephrine if you have a heart history. Safer options like saline nasal rinses or antihistamines don't affect blood pressure. When in doubt, check with your doctor. Your heart shouldn't pay the price for a few days of clearer breathing. Number 2, proton pump inhibitors, omeprazole, pantoprazole, and others. Millions of older adults take proton pump inhibitors, or PPIs, every day. Medications like omeprazole, pantoprazole, esomeprazole, and similar drugs are commonly prescribed for acid reflux, heartburn, or gastritis. At first glance, they seem safe and effective, but what many don't know is that long-term use can quietly harm heart health. These drugs reduce the amount of acid produced in the stomach, which helps ease heartburn symptoms in the short term. However, stomach acid isn't just for digestion. It's also key to absorbing essential nutrients like magnesium, calcium, and vitamin B12. A long-term magnesium deficiency can have serious effects on the heart, including irregular heart rhythms, muscle weakness, cramps, and ongoing tiredness. In some cases, low magnesium levels go unnoticed until a serious complication arises. PPIs can also disrupt the balance of bacteria in your gut, leading to widespread inflammation, which recent studies have linked to a higher risk of heart disease. Another issue is that many seniors take these medications for years without regular medical review. I've seen patients who started omeprazole after a bout of heartburn and kept taking it out of habit, not realizing it was no longer needed. Over time, side effects build up and can worsen existing problems. Of course, you shouldn't stop PPIs suddenly. If you're taking them daily, talk to your doctor. You may be able to lower the dose, switch to other treatments, or even stop if they're no longer necessary. Reflux and heartburn are uncomfortable, but they shouldn't be managed at the expense of your heart health. Always prioritize a balanced approach that cares for both your digestion and your heart. And now we've reached number 1, the most common and at the same time potentially the most dangerous medication for your heart when not carefully monitored: calcium channel blockers. These drugs, such as verapamil and diltiazem, are often prescribed to treat high blood pressure, chest pain, angina, and irregular heart rhythms. They're effective, yes, but they require close monitoring, especially for older adults. Their main job is to relax blood vessels and reduce the heart's workload. However, in seniors over 60, whose hearts may already be pumping less strongly, these medications can slow the heart rate too much, leading to bradycardia, dizziness, severe tiredness, or even fainting. In some cases, the heart struggles to pump enough blood to the brain and vital organs, raising the risk of serious complications. Additionally, calcium channel blockers can cause fluid retention, leading to swelling in the legs or ankles. This swelling might be mistaken for vein problems or kidney issues, but it's often a direct side effect of the medication. Another concern is that because these drugs are so widely used, some doctors prescribe them without regularly checking how the body responds over time. As we age, our metabolism changes, and what worked well 5 years ago might now be straining the system. It's also important to know that these drugs can interact with other common medications for seniors, like beta blockers or diuretics, amplifying their effects or causing dangerous interactions. If you're taking verapamil, diltiazem, or another calcium channel blocker, don't stop on your own, but pay attention. If you notice unusual tiredness, a very slow pulse, dizziness, or persistent swelling, talk to your doctor. There may be newer alternatives or dose adjustments that better protect you. These medications are powerful allies, but they can also be silent risks if not carefully managed. Your heart deserves attention, precision, and ongoing care. We've covered a list of 8 medications that, while common and often necessary, can pose a quiet risk to the heart for people over 60. These aren't inherently dangerous or banned drugs, but they do require closer monitoring, more frequent conversations with your doctor, and a deeper awareness of how they affect your body over time. We've discussed NSAIDs that raise blood pressure and cause fluid retention, thiazolidinediones that can trigger heart failure, sedatives that disrupt heart rhythms during sleep, tricyclic antidepressants that interfere with the heart's electrical signals, decongestants that tighten blood vessels and increase pressure, proton pump inhibitors that affect nutrient absorption, corticosteroids that disrupt the body's balance, and finally, calcium channel blockers that can dangerously slow the heart rate if not properly managed. I'm not telling you to stop taking any of these medications on your own. Instead, my message is that you have the right to be informed, to ask questions, and to review your options with your doctor. Modern medicine is always evolving, and treatments should be tailored to the stage of life you're in. If you or someone close to you is taking any of these medications, keep track of symptoms, check in regularly with your doctor, and consider using tools like health apps designed for seniors. Managing your medications is also a way to protect your heart. Share this information with your loved ones. It could make a difference. If you haven't already, consider subscribing for more clear, reliable advice created especially for people like you. Your heart has worked tirelessly for you your entire life. Now it's your turn to care for it with knowledge, awareness, and action.